Welcome to the Medical Staff Voice Live. I'm Dr. Stan Frochtzwajg, Chief Medical Officer at Community Memorial Health System, and I'm joined today by Dr. Narasimhulu. Welcome, Dr. Narasimhulu.
Thank you so much. I'm so happy to be here.
Thank you. This is a great opportunity for our medical staff and community to learn a little bit more about you and your practice. In order to do so, we have a few questions that will enlighten us and give us better insight into your specialty. First thing, tell me a little bit about yourself. Tell us about you. Where are you from? Where did you train? And what brought you to Ventura?
I was born in India, down south, and I went to med school there. I did an OB-GYN residency in India as well, and I was practicing for a few years as an OB-GYN before I moved to the United States. And so I redid another residency in Brooklyn, New York, and then I worked as a generalist for another couple of years in the Bronx before going on to a fellowship in GYN-Oncology at the Mayo Clinic. And once I graduated, we decided that we wanted to be someplace fun, vibrant, diverse, and a little bit like home. And so I think Southern California was a great fit.
Wow, that is impressive how much training you've had. And what's also impressive, you should be at least twice as old as you are, based on, the amount of training you had. So thank you. Could you tell me a little bit more about your subspecialty in GYN-Oncology? What does that entail so that people have a better understanding? And what kinds of procedures might you attend to versus gynecologists at large?
So we primarily take care of women with cancer of all ages. We are happy to see some of the pre-cancers as well that the gynecologist might not be comfortable managing. The most common cancer I see is endometrial cancer, but we also take care of cancers of the ovary, the cervix, the vagina, the vulva. In addition to that, we also get a lot of referrals for complex surgeries that are benign, because cancer tends to distort anatomy, and so I think we are kind of more comfortable with distorted anatomy. At least I am more comfortable now than I was during my practice as a gynecologist, handling complex stuff minimally invasively. So I often get referrals for patients who've had multiple previous surgeries and there's concern for adhesions, and patients like that.
And those can be remarkably challenging, not until one has entered an abdomen or pelvis with numerous adhesions can one understand that concept. So I compliment you for actually making that a primary interest. Thank you.
Yeah, I do. I find that once in a while a challenge, and I'm going to get this done with these small incisions so the patient can have a much better outcome. Kind of, I think makes my job a little more rewarding, like, going through some of these challenges and feeling like, yes, okay.
Very good, thank you. Where is your practice located, and what age groups do you treat?
So my practice is right across the street from the hospital at the corner of Brent and Loma Vista, at the CCCGO, Central Coast Center for Gynecologic Oncology. And we pretty much take care of women of all ages. I've often had patients who are younger than 18, and we kind of tend to coordinate with the pediatric surgeons for that. But
very nice. Well, that certainly is a service to our community. So we know about your professional diversity and expanse. How about your outside interests, hobbies, sports? What do you like to do when you're not being a doctor?
I have 2 little kids, so after all this training that I've kind of almost ignored them, we love to spend time together, being outside, gardening, cooking together, doing yoga, hiking. Oh my God, hiking in Southern California is awesome. So we enjoy doing that together as a family.
Have you checked out Harmon Canyon yet?
No.
Oh, I'll have to tell you more about that later. Very good. Well, great. This next segment, we transition to something we call this or that. And for me, it's the most fun. So just allow yourself to have a stream of consciousness. There are no right answers. When you're on an airplane, would you choose an aisle or a window seat?
Window.
Why?
so I can look at the view.
Ah, good answer. What's your preference? A day in the office or a day in the operating room?
Operating room for sure.
I believe that. If you didn't become a physician, this is a tough one, what would have been your backup plan?
When I was little, I was obsessed with, I don't know, science and the universe. And for the longest time, I thought I was going to be an astronaut and I was going to explore space and, discover all these amazing things about our universe.
Well, they may need physician astronauts, so don't wrap up that dream yet. If you had a choice between superpowers, being invisible or flying, which would you choose?
Flying.
If you could compare yourself with any animal, which would it be and why?
That's a tough one. I haven't thought about that. I guess I would think, the lion maybe?
I like that. That would fit your specialty. Perfect.
Yeah.
What is the best advice you would give your high school self? Study more, be more careful driving, or something else that you achieved with your wisdom?
Take every day as a gift.
Wow.
Don't stress about little things.
Wow.
Life is short. Enjoy it.
That's the best piece of advice I've heard. When you were in medical school, what was your favorite subject or topic in medicine?
I actually liked anatomy. I got a bunch of gold medals in anatomy, and so I always liked fixing things with my hands, even if something's not working in the house. It's usually me that's taking it apart and trying to put it back together. So I think, so it's perfect.
How apropos to your specialty. When you're traveling in an automobile, would you rather be the driver or the passenger?
The driver.
Fits. Card game or board game? What is your favorite game to play?
Board games.
Board games. Oh, I like
strategy.
that. Mm-hmm. What is the most interesting about you that we would not learn from your resume?
I speak 4 different languages and a little bit of a 5th.
Oh my gosh, that is wonderful. That's impressive. That's not common for most Americans, as you know. Thank you for tuning in to learn more about Dr. Narasimhulu. For more information on all the services and specialties offered at Community Memorial Health System, visit cmhs.org. And be sure to like and subscribe for more from your community health system. Thank you, Dr. Narasimhulu.
Thank you.
You're welcome.